Okay, everybody, thank you so much for joining us today. Please feel free to ask questions at any moment. Gila is with us. She'll be more than happy to answer each and every question. So, actually, at the beginning, I would like to emphasize that CliniCrowd does not provide any medical advice. For any medical advice regarding how to manage your disease or which medication to take or not take or reduce medication doses, please consult with your doctor. So it's all started with our friend Danny here in the picture that was diagnosed with Parkinson's about 5 years ago. As you all probably know, Parkinson is a chronic and progressive movement disorder, which means that symptoms continue and worsen over time. You don't expect Parkinson patients to get improved or progression to stop. Research found that the cause for the disease is a protein called alpha-synuclein, which exists in the body and brains of all of us. For some reason, in Parkinson patients, it starts clumping in the brain and it kills the cells that produce the dopamine. And it kills them one by one, and that's why it's a progression disease. As of today, there is no definitive test for Parkinson's disease. Doctors use what they see to tell you. They look at symptoms, they ask you what you feel, and they diagnose Parkinson according to what they see. And sometimes there are mistakes. So when our friend Danny was diagnosed for Parkinson, for us as friends, we start looking for solutions for his Parkinson in order to help him. And of course, we were researching for an alternative and effective solution. By accident, we got to Professor Danny Segal from Tel Aviv University, which is a professor for biology and microbiology, and he investigated the effectiveness of mannitol, of the self non-caloric sweetness, uh, on the alpha-synuclein, the protein that is the cause for Parkinson's. So mannitol is approved by the FDA, the Food and Drug American Authority, as a safe for human consumption more than 65 years. It has very low calorics and glycemic values, so it's safer also for people with diabetes. It's naturally produced by bacteria, yeast, fungi, and it's in purple onion, in pumpkins, and many others as well. And is commonly used for coating candies, for ice creams, for cakes, for many other foods as well. The FDA mentions that the only possible side effects is if you eat more than 0.7 ounce or 20 grams per day, you can get some stomach laxative effects or maybe even diarrhea. Mannitol is also approved by the FDA as a drug, and then you can get it IV through the vein, and it and then it's a larger amount of mannitol, and sometimes it gets more terrified than side effects, and that if you go to the internet and you find the terrified side effects about mannitol, it's probably related to the mannitol as a medication and not to the mannitol as a food supplement that we are using here. So Professor Segal took the alpha-synuclein, the cause for Parkinson, in the test tube in his lab and start by trying error different materials. Amongst them was the mannitol, and he saw that mannitol prevent the clumping of the alpha-synuclein in the test tube. So he moved to the next stage, which is fruit flies that were genetically engineered to carry the human symptoms of Parkinson. They took two tubes, one of them flies that got Mannitol, the other one flies that didn't receive Mannitol, and he saw that the flies that received the Mannitol looked healthy and flew all over the tube, while the other were on the ground, unable to move. And when he examined the brains of those flies, he saw that the amount of alpha-synuclein in the brain had been reduced by 70%. That was quite promising. So he moved to the next stage, which is mice. For this purpose, he joined Anne with professor from California University, San Diego, that is known for his Parkinson mice, and the results with mice were more or less the same. Mice that got the mannitol, received mannitol, look healthy, and those that didn't receive mannitol look sick. And so after you succeed in two stages, in two steps in animals model, you want to move on to the human research. And for but unfortunately, it didn't succeed to receive any grant or financing to keep on the research. And that's because the Parkinson medication market is worth about $5 billion a year, and Mannitol you can buy over the shelf for $34 per kilogram. So there is no incentive to promote this solution for Parkinson. So after not receiving the grant to keep on the research, Professor Segal published his finding in a very well-known biologic journal and keep on with his life. Surprisingly, after 7 months, he started getting emails from people all around the globe. All of them the same story. We were diagnosed with Parkinson's disease a few years ago. By accident, we got to your article. We saw that there is no safety issue and we got nothing to lose. As they start taking Mannitol, 1 teaspoon in the evening, 1 teaspoon in the morning, each and one of them different dose, but all of them reported improvement in the Parkinson grade and symptoms. At this stage, it was very easy to us to tell our friend Danny, come on, why won't you give it a try because there is no safety issue. But we couldn't remain indifferent to the suffer of PD patients all over the world. And we thought the Parkinson community has the right to know that there is an option, safe option for their disease. And we decided to launch the CliniCrowd platform that will make information about safe solution for disease that the pharma companies have no interest to investigate due to lack of financial incentive, and use the diversity and experience of the global crowd to test the efficacy of those solutions for preventing or helping the disease. And the platform in return will provide analytics and share insight, allow the individual participate of the crowd to better manage their personal symptoms and improve and affect the life of all of us. So as the first stage, we met with the neurologist of our friend, and she told us that the current medication market for Parkinson's worth about $5 billion a year. All medication treat only symptoms, and here for the first time we must get something that treats the alpha-synuclein, which is the cause for the disease. Also, she said that all current medication has terrible side effects like depression, like illusion, like mess in the brain, and they are good only for 4 or 5 years. After that, you need to take more medication, and they get also side effects. And she also said that a good neurologist see patients once in 6 months, sometimes 9 months. They not really nothing to do. So we decided that we are establishing this platform, and we met with the first group of 25 Parkinson patients in a dancing group, and we came 15 minutes after the lesson to tell them about the project, and we stayed for more than 90 minutes because they asked a lot of questions, and they decided that they will give it a try, and they are going for it. So they fill up the initial questionnaire, start taking the Mannitol, and after 1 month, surprisingly, 24 out of 25 reported improvement in at least 3 to 4 Parkinson's symptoms. For us, it was a real shock because we started this program thinking that we might stop the progression of Parkinson's disease. We didn't imagine that it might also improve some Parkinson's patients. And we asked Professor Segal what might be the reasons that people feel improvement. So one of the explanation was it might be placebo effect, and the other explanation was that might be that the alpha-synuclein, the synuclein is not killing the cells immediately. It takes time. So if mannitol gets to the cell before the alpha-synuclein kills the cell, so it might be recovered. So we keep on with the event, and as of today, if you go to our website register, you can see a lot of statistics about our community today. Actually, we have patients from 42 different countries, most of them Israel, United States, United Kingdom, Germany. I have to emphasize that we didn't do any marketing activities. All of that happens from mouth to ear, ear to mouth. People that took Mannitol and it helped them, told their friends, told their families overseas, all over the world. So it went from ear to mouth, and people are using Mannitol all over on 42 different countries today. We can see that the global community actually mirrored the averages and the community in CliniCrowd. For instance, the ratio between men and women in Parkinson's patients in the world is 33% women and 65% men. Also, our community is 33% women and 67% men. We know that the average age of diagnosis is 62. Also, the average of diagnosis in CliniCrowd platform is 62. I have to mention that the youngest participant is at the age of 25, and he was diagnosed at the age of 15. And the oldest one is at the age of 96, was diagnosed at the age of 75. In the world, the youngest person that was diagnosed with Parkinson, it's a baby at the age of 2 years. If we look at medication, we see that the average amount of medication that Parkinson patient takes is 2.5. Also in our platform, the average is 2.5. And the most popular medication is Agilent, Dupixent at the second place. We also see that there is about 11% of patients that are not taking any medications at all. And we know that there is at least one person that reported taking 23 different medications per day to control his Parkinson's symptoms. And this is really. Now we'll go to the interesting finding. If we analyze patients that are taking Mannitol more than 6 months, it means that it's after the placebo effect of the Parkinson, we see a lot of them get improved. And the most significant improved that 88% regain their sense of smell. And as of today, there is no evidence for any Parkinson patient that regains their sense of smell. No medication, no treatment that help patients regain sense of smell. 86% improve their facial impression, and they lost the mask face that the Parkinson mask face that they had. Also, our friend Danny got his baby face as he was before the disease, and his poker face, mask face disappeared. We also saw that 72% reduced drooling severity, muscle cramp stopped, 70% pain stops, and also 69% fall stops, which is the main reason for hospitalization between Parkinson patients. We also see that 56% report improvement in the Parkinson symptoms, while the average drug effectiveness is between 2 to 33%. We know that the best drug to treat cholesterol affects only 1 in 50, means 2%, and we got 56%. That's really amazing. We can see that patients show greater improvement the longer they took Mannitol. So the longer they take Mannitol, more symptoms were improved. And best improved is a female Parkinson patient at stage 5, age 67, taking Mannitol since January 2017, and she was best improved almost in each and every Parkinson symptoms. We see improvement in all ages. We see improvement at all years since diagnosed. And today I heard from a Parkinson patient that he lives with Parkinson already 15 years, and he reported improvement in his Parkinson trait and symptoms. The next thing that we are investigating is Parkinson preventable? As we mentioned, Parkinson is a progression disease that starts sometimes 10, 15 years before you're diagnosed. Once you're diagnosed with the disease, already 60 to 80% of your cells in your brain are dead. So if Mannitol prevents the clumping of the alpha-synuclein, if we'll take it preventively, maybe we can prevent the disease. And there are some early signs for Parkinson's disease. Sometimes they happen, sometimes they not. One of them, reduced or low sense of smell, trouble in sleeping, change in handwriting. Your handwriting becomes smaller. And as of today, I can tell about myself. My father has Parkinson, and 3 of his brothers also had Parkinson. And I start taking Mannitol preventively. And after 5 months of taking Mannitol preventively, I regained my sense of smell. And this is really amazing. And today we have more than 150 people at high risk for Parkinson because they did a gene test or they had the first family members that has Parkinson that are taking Mannitol preventively. And if we'll succeed in preventing Parkinson's, that might be a huge of this platform. All this magic happened in our website, which is CliniCrowd.info. You go to the website, you can select your language, English or Spanish or Hebrew. Then you scroll down, you get to the disease, and you can choose Parkinson and Mannitol, Parkinson prevention, Alzheimer, or any other disease that we have solution today. Our platform, as I mentioned before, make accessible information about disease, but only solutions that were scientifically investigated. It means that there is a professor, a research behind it, that did research at least that animal model, sometimes even human research, and we are in contact with the professor. He is with us, he can answer questions, and we also have a doctor that can support all these. So you select Parkinson from the disease, then you fill out initial registry, and then every month or 3 weeks you fill out a follow-up registry, and then you access your personal and community reports and see your progress. We also have frequently asked questions. If you go to frequently asked questions at the support, you can choose Parkinson, it's in the middle, and there is answer to all your questions. If you don't want to search here or you have any ask question, you can email us at info@clinicrowd.info at any time, or you can email or call Gila. She'll be more than happy to answer any question. Me as well. We're here for the Parkinson patients all the time. One question that many people are asking, what is the required dose of mannitol? So after you fill up the Parkinson initial registry, you will be directed to a page that has a formula, and then you can find what is the amount of mannitol that is recommended for you. Uh, for each person, there is a recommended dose that is calculated according to his weight. And if you take more or less, sometimes it doesn't affect the same. Because of the laxative effect of the mannitol, we recommend to start with half a teaspoon a day for the first week or 10 days, and just after that, start adding amount until you get to the recommended amount. We have evidence for some patients that at the beginning mannitol causes them some laxative effects, but after a week or 10 days, most of the time it passes. And if you have to choose between Parkinson and laxative effect, of course, I'll choose the laxative effects. So many people are asking us, what is the catch? What are you doing it? What you and CliniCrowd are gaining out of this? So this is very simple. We are a social impact company. We want to make a change. We hope that the data we collect improve well-being of patients all over the world. We have no financial agenda on the back of the patient. We're doing it only to do good and help Parkinson patients over the world. We are not affiliated with any mannitol manufacturer. We are not selling mannitol, and that was one of our basic condition. We come to do good. We want to help Parkinson patients, and we don't want to make money, or we don't have any financial agenda on the back of the patients. Our next steps will be to make the follow-up even easier with applications that will help. Mask face tracker, you'll do a selfie of yourself once a day or once a week as you want, and we'll analyze the picture and we'll track your mask face if it's improved or not. Of course, we'll use the mobile phone accelerometer to measure tremors, length and stress, and of course step tracker. We know that the voice became weaker with Parkinson's when it's improved with Mannitol. So we'll also develop a sound meter, will help measure the sound and get insight, sleep tracker, and many others. And also will connect to wearable devices. And we'll keep all this data in our big data database, and we'll analyze them in order to get new insight about the disease, and of course share them with all our community. We also will develop a voice-based questionnaire in order to help people that have problems to answer in computer. So again, around your poster, you will see the question, or you can hear the question. And if you choose normal poster, you just say one, and we'll collect the data to our database as well in order to make it easier. As of today, why is CliniCrowd so unique? Why the pharma companies are not investigating Mannitol? Because clinical trial costs a lot of money, and it takes 12 to 15 years, and it's limited geography. If a pharma company wants to do a clinical trial in New York area, they will probably take 50 to 60 patients in New York area. And it's clean data, controlled, and there are a lot of research today that shows that same medication doesn't affect the same during the clinical trial and 1 year after. because of all the tension that patients get during the clinical trial and the clean data. While CliniCrowd crowd registry is cost-effective, you can see results as fast as 12 months, and it's ongoing. It's never end. We keep on validating the information all the time. It's global. We get information for 5 different continents. So it's a much accurate data. It's real life data. We provide real life evidence. You keep on with your life and we are sharing the information. It's large number and of course it's flexible and extendable. If you want to add question, to remove question, it's very easy to do. As of for today, it's a win-win situation for everybody, for patients, for pharma companies, for doctors, for everyone. Each one of the patients can maintain a clean record of their disease and test which treatment works best for them. For instance, you go to your personal zone and you have a tool, a personal medicine concept. You can see from the beginning or from the previous survey, all of your symptoms families were improved or worsened. When it's green, the lower the number, it's meant it's improved. So you can see your common symptom, motor activity, tremor, daily activities, or quality of life. You can drill down to each and every symptom and see each and every symptom if it was improved since initial or since previous. And you can also see a graph of your progress from each and every server. And at each and every moment, you can compare your status via community fellows. For instance, if your average is 47, your age group and gender is 89. It means that you are better because your number is lower than your age group and gender. You can see that the average at the United States is 34. It means that you are worse than the average at the United States. You can also compare to people that are doing Tai Chi, that are taking specific medication, or any other comparisons that you want to do. You can also see a trend graph. If it's green, it means that you were improved. If it's red, it means that you were worsened. So all of this is for you, for the patient. And you don't have to take Mannitol. You can test which treatment works best for you. If you want to test yoga, specific medication, Tai Chi, running, dancing, whatever, you just fill up your initial questionnaire, then you start the things that you want to check, if it's yoga or medication, then you fill up follow-ups and you can see how it affects your all Parkinson's disease and each and every symptom as well. And of course, once you go to your doctor, 1 in 6 months or 9 months, and the doctor asks you, okay, what happened during the last 9 months, and you don't remember, so now you can print out the report which contains what happens with all your symptoms, all medication, all side effects over the last 9 months, and now your doctor can improve his diagnostic toolbox and get decision based on information and not just ask and take decision about what you don't know. And of course, CliniCrowd gets valuable data assets and can get insight about the disease and share it with its crowd. Next steps, we're also going to do Alzheimer's disease with different research about cinnamon extract, about promenade, and also diabetes disease. That will be next stage. So if we want to summarize, first, it's important to say that no two people with the exact same Parkinson's symptom. So is Mannitol. You don't accept, it's not a magic. You have to be patient and a lot of patience, and it can affect differently each person. And we see, we have reaction from patients in the US, in the UK, that one of them the mannitol start affecting him only after 7 months of using it. So we have to be patient, and this is the name of the game. And of course, if you take mannitol and you will not share it on our platform, we will not be able to understand the efficacy of mannitol and will not able to share and report it to the other patient. So your participation is required to the success of this project. We know that it's not, that there are some technical issue. We know it's not easy for patients to fill up the questionnaire and the follow-up, but I have to emphasize that we are doing everything with a very, very low budget, and we are volunteering to this project, and we're doing the best we can to improve and to do best for Parkinson patients. So I really, really ask you to be patient as well. I would like to emphasize again that CliniCrowd does not provide any medical advice. We just share the experience of other Parkinson patients and both the experience with mannitol, and our goal is to do good. If you have any question and you don't know if to take mannitol or not, or you want to change uh, medication doses, please consult with your doctor. I would like to show you now the Professor Segal research about the mannitol. There is English headlines, so you can see it. You can read it. Okay, thank you so much. This is the end. I would like to thank you for participating. I would like to apologize again for the inconvenience with and the technical issue at the beginning. We're really trying to do our best to bring this information to as many Parkinson patients as we can in order to help them fight this disease. We really know from our friend and from my family how terrible is this disease. So where is with you? Thank you so much for being with us tonight. You can see this recording on our YouTube. You can ask questions at any moment at info@clinicrowd.info, or you can email Gila or myself at any time, and we'll be more than happy to answer. Thank you so much for being with us.